are talking about how to manage depression, anxiety, and MS, and we're going to take a whole person approach. We're going to go beyond what our conventional therapies offer us. Those are important as well, but I don't think that that's all of it. So I want to give you a very comprehensive approach. So today we're going to talk about why depression and anxiety are common in MS. We're going to talk about causes of anxiety and depression, perhaps things you haven't thought about. And also, we're going to talk about treatment options beyond medications, not as a replacement for your medications, but as an adjunct, as something you add on. And we'll also talk about some supplements, because when people come into these circles of integrative and functional medicine, they generally want to know, what's the supplement I take? So I'm going to give you my take on which supplements work, what you can start experimenting with, and what you should probably let go of. Okay, so this was a systematic review, a meta-analysis where they pooled data from multiple similar studies to figure out what's the overall effect. There were 12 studies looking at over 7,500 patients with MS. And what they wanted to know was, how prevalent is anxiety and depression? And if you look at these dates, it went from 2015 to 2021. So it did capture a part of the pandemic, which we know caused anxiety and depression and stress to go through the roof. So roughly, it's about 1 in 3 people with MS are dealing with anxiety or depression, or even both. These conditions tend to co-occur. And so it wouldn't be unusual for people who experience anxiety to also experience low mood. So it's common. And I actually feel like these numbers are even higher based on what I see in my interactions with patients. Very, very common. And there's many reasons for this, from just our busy lives to too many demands to our health conditions. This is going to help us kind of get a better understanding of how we think through mental health issues from a conventional medicine perspective. So certainly genetics play a role. Many of us have a family history of family members who've had anxiety and depression. We tend to explain depression as maybe a deficiency of serotonin, and a lot of our drugs increase serotonin levels, for example. Medical conditions like heart disease, liver disease, kidney disease can lead to depression and anxiety as well. So can problems with hormones like an underactive thyroid. Nutrients like B12 are really important. So if you are being followed by your primary doctor or psychiatrist, they may very likely have checked a vitamin B12 level on you. It's not the only one. There are many others, but that's a very common one it's like low-hanging fruit. And then substance abuse, from alcohol to other drugs, can certainly impact mood. So can trauma. And I'm talking about either physical trauma, like getting into a car accident and having all of the aftermath of that, as well as emotional trauma. We know that people who have had significant trauma experiences, especially in childhood, tend to have higher rates of anxiety and depression as adults. And the reason I'm giving you this list is because I want you to reflect back about what might be some of the reasons for you, because that actually gives us a clue as to what might be helpful in improving your mood. So I want to build on my conventional medicine thinking and expand upon some other things that perhaps conventional medicine doesn't fully explore. So functional medicine is a very holistic system of medicine where we look at the body in terms of different functions, rather than chopping up the body into organs and giving each organ to a specialist, as we do in Western medicine. So in functional medicine, we think about everything on the left-hand side, but we also place a lot of importance on stress and what it does to the body as a result. Poor nutrition, disrupted sleep and insomnia, sedentary lifestyle, toxic exposures. And then if we kind of dig into some body systems, when you think about the immune system dysfunctioning, as many of us have figured out how to do with our autoimmune diseases, diagnoses, people who experience autoimmunity, inflammation, if you have a diagnosis with an itis at the end, you're more likely to experience anxiety and depression. And here's one we don't think about often: allergies. People who are allergic, there might be histamine release. When you release histamine, your blood pressure can fall, and as a result, your heart rate can go up, and that can feel like anxiety. So it's important to kind of do an assessment of a person from head to toe to try to understand what are the underlying causes of mental health issues. I would add to that, if your gut microbiome is disrupted for any reason, antibiotics, trauma, stress, poor, nutrition, if those good bugs aren't present in your gut microbiome in the relative amounts we want to see them, that can also contribute to mental health issues, as can dysfunctional mitochondria. Mitochondria are the parts of your cell that produce energy for you. And when we don't put out enough energy, we get a lot of different symptoms like mood disorders, anxiety, depression, fatigue, muscle pain, arrhythmias, chest pain. So what I'm trying to drive home here is that anxiety and depression are complex. Rarely is there one cause. And if these are diagnoses that you're dealing with, they're multifactorial. They're probably hitting on multiple bullet points from both sides of this slide. Now, what I don't want you to take away from this slide is that you have to attack each bullet point separately. The approach I'm going to talk to you about is going to address all these bullet points, except maybe the genetics part, simultaneously, because we're going for root cause improvements. We're going to attack mental health at the root cause level. So here's an interesting study here. This basically looked into the relationship between depression and MS. And what they actually concluded was that oftentimes depression precedes your diagnosis of multiple sclerosis. So we aren't getting depressed because we have a diagnosis we don't like, and we're reacting to the diagnosis and becoming depressed. Actually, depression can precede the diagnosis of multiple sclerosis by quite a few years, if not more. And what they concluded was that when there's increased inflammation in the body, and there are these cytokines, which are communication molecules of the immune system, and these inflammatory molecules reach the brain, among many other things like MS, they can cause anxiety and depression. Anhedonia is a word that basically means that you are no longer able to find joy in the things that previously you were interested in. It's a really common symptom of depression. Also, because these cytokines that are inflammatory reach the brain, you can also have sleep problems and fatigue. So it's rare that people have anxiety in isolation or just depression in isolation. They oftentimes have low energy, disrupted sleep, mood is off. So it's kind of a big soup all mixed up together usually. So let's start by talking about stress and mental health. We know stress wreaks havoc on the body. It puts the immune system and the nervous system on high alert. It stresses the hormonal system. It causes your gut health to go out of balance. And there is a very strong correlation between stress and anxiety and depression. And so this is an opportunity. If we can better manage stress, we can make anxiety and depression better. And there are lots of ways that stress management techniques can be helpful. So this is a study actually out of my group where I work at Stanford. They basically took various different short breathing exercises and compared it to mindfulness meditation. And what they found was just a brief 5-minute exercise of breathing, where especially if you were to lengthen the exhalation portion of your breathing cycle, it actually did even better than mindfulness meditation, right? So I'm not saying mindfulness meditation is not important, because it is a wonderful tool and it really can be an important therapy for anxiety and depression. But even a 5-minute breathing exercise can have profound effects on a lot of these hyperarousal symptoms that go with anxiety. And also it was able to help lift mood up. Here's another study where they did an 8-week intervention where every day the group had to meditate for 13 minutes. And what they found was at the end of the 8-week period, people had better mood, they had better brain function, so they had better attention, they could basically get through tasks better, anxiety was better compared to controls. So while even a 5-minute breathing meditation can help ease the symptoms of anxiety and depression, if you can commit to 8 weeks, something a little bit more long term where it really starts becoming a habit, it really starts turning things around. So this is a tool that's actually really powerful. Hypnosis is also very effective. And hypnosis isn't always easy to access because it can be expensive. It's not always covered by insurance, although it can be. There was a meta-analysis, again, taking many studies looking at hypnosis and anxiety. And what they found was that people who did an intervention of hypnosis, it reduced their anxiety by almost 80% compared to controls. That's a lot. We don't even have medications that can work that well. And the other interesting finding was that when hypnosis was combined with other psychological interventions, maybe it was cognitive behavioral therapy, maybe it was medications, that it worked even better. So if you are not able to access hypnosis, there is a wonderful self-hypnosis app called Reverie, Reveri. It's developed by Dr. David Spiegel, who is the medical director of our clinic at Stanford. And it really just makes self-hypnosis very accessible. And you can listen to the different exercises and do self-hypnosis on yourself and see how it goes. So again, it's another tool. So when I asked you to come up with 2 or 3 things that you're going to walk away with today, perhaps you look into what, a breathing exercise, a longer program, or self-hypnosis. And so stress management just has to be a part of our strategy for better mental health. So I always talk to my patients about removing any stressors that are removable. And I challenge you, maybe by the end of today, to come up with 2 or 3 stressors in your life that you can easily remove. It could be a commitment that you're kind of tired of, that you don't really look forward to. It could be some ritual or something you do that's unnecessary, right? It could be just decluttering your house to make things easier, right? Like, what are 3 things you could do to immediately declutter your life and your mind? And for all the other leftover stress, it's important to build coping strategies. And this can come in many forms. I don't want you to think that all there is mindfulness and meditation, and you have to sit there for 45 minutes in silence. Truthfully, I think that's not possible for most people, myself included. Some of us need to move. Some of us need to be more active when we are getting into a more calm state. So perhaps you can engage in various breathing exercises. There are lots of different apps online, like the Calm app or the Insight Timer app, where you can find lots of mindfulness exercises, lots of breathing exercises. This is my personal favorite. Exercise is my meditation. And anytime you move your body, you start integrating the body with the mind. You sort of become one whole being rather than this entity where the mind is kind of where you spend most of your time and the body's just kind of forgotten. So when you exercise, you actually bring the body into the equation. And I know some of you are very good about your exercise, and it is probably one of the main things that's contributed to your ability to live well with MS. So any kind of exercise. I mean, it could be Qigong or Tai Chi, some of these Eastern exercises. It could be yoga. I love this website called Yoga with Adrienne. You can go on YouTube and find her. It's free. It's accessible. You could do very simple yoga that is going to be in line with your particular ability level. We all come here with different levels of physical ability. So finding what feels good is really important. For those of you that have a religious practice, prayer can count as your meditation if you're really being very intentional about using it that way. And I'd also put a hobby in there. Have any of you ever engaged in something you love, like knitting or painting or working on your car, and you just get lost, right? You're in flow, you've lost all sense of time, and you are immersed. I would give you credit for that as well as a stress management technique. But you've got to build time to do these things. And you deserve to have time to do these things because this is self-care and it's such an important component of MS care. So, oh, and I forgot to say time with loved ones or pets. And that's why I put that picture there. You know, anytime you cuddle with something you care about, it could even be a tree, you release beneficial hormones, right? And your immune system loves that. So spending more time in things that bring you joy. So just make sure you schedule it and you are paying attention to this. I started with stress management because I think it's the most important. If you ask most people with MS about trauma, you'll come away with learning that a great majority of them have had lots and lots of stress. And there's a personality trait that goes with people who develop autoimmunity. So now not everybody fits into it, but the topic for another discussion another time. Let's move into the power of food and nutrition to impact mood. I'm going to give you some high-yielding things here you can start doing to start improving your mood. So just to start with a couple of studies, large study of British office workers, followed them for 5 years. Those who were on an inflammatory Western diet had higher rates of depression, and those that were on plant-based diets had lower risks of depression. And so what I want you to take away from that is you don't have to become a vegan or vegetarian, but just eating more plants helps. Another study showed a Western diet that's associated with inflammation can contribute to depressed mood. And what they found in this study was people who had elevated levels of CRP, C-reactive protein. This is kind of a crude marker of inflammation. We don't have great labs to measure inflammation, but CRP is one that is often used. Those who had higher levels of CRP had a higher risk factor. It was basically a risk factor for depression. So inflammation and diet have a lot to do with mood. Another study that gives me hope showed that brief dietary changes of just 3 weeks improved depression. And that effect persisted far beyond the study, up to 3 months when they checked in with these people. So food clearly plays an important role in our mental health. So here are some top nutrients I want to make sure you're getting. My approach is not for you to copy down the lists I'm going to show you for magnesium and for zinc and calcium and go and buy and eat those foods. I'm going to show you the foods that are high in these nutrients, but what I want you to do is to start a diet that is just generally nutrient dense. And you may need to supplement with a multivitamin, multimineral, but I want you to know kind of what's important and how to kind of hone in on the foods that are going to be high yielding for you. So let's start with magnesium. And I put this picture of the pumpkin seeds and the one little almond because these are great sources of magnesium. When studies show that when people are stressed or sleep deprived, magnesium levels drop. And magnesium is actually a very calming nutrient. There's a study that showed that when you replaced magnesium intravenously, it improved depression in women. So here are your food sources. It's a lot of nuts and seeds and vegetables and beans. So I'm not generally a big fan of supplements, but I think if you wanted to try magnesium, especially for anxiety and sleep, it's reasonable. I recommend getting the glycinate form, which has more systemic effects, and trying it for a few weeks to a few months to see how it goes. And I generally like it to be taken at night. It's calming. It's going to help with sleep. It can help with nighttime anxiety. You can also try a magnesium supplement during the day for daytime anxiety. I would just caution you to do it on a day where you're not driving and you're not getting a little bit too calm and relaxed. So I want you to always get everything from food first, but magnesium is one that I'm not against supplementing. Zinc plays a really important role in neurotransmitters like GABA, which is very calming on the brain, 5-HTP, which gets metabolized to serotonin and helps improve mood. So low zinc levels are correlated with depression, poor concentration, and just mood lability. And there was a study that showed when zinc was supplemented, people reported less depression, and they did better on their antidepressants. Okay, so zinc also is a top nutrient for mental health. Here are some foods. Here are your animal derived foods, seafood, beef, eggs, dairy, and then here are some other plant-based foods like beans, seeds, and this is just a simple list. There's certainly many more foods that are good sources of zinc. So this is why starting to move towards a more plant-based diet starts helping mood, because you start bringing in more of these nutrients. And then calcium is important. Calcium is not just important for bones and teeth. I know when we hear the word calcium, that's what we think about. But low levels of calcium are associated with stress, anxiety, and depression. And women who struggle with mood in the premenstrual period also tend to do well when they increase the calcium in their diet. So in this Korean study of women, those who had higher calcium intakes reported less depression. Food sources, I know we always think of dairy products, but fish and seafood are also good sources, as are all of these different plant-based foods. So again, a plant-based diet will help get more of these foods into your diet. Let's talk about the B vitamins. I can go on, and there are many B vitamins. I'm going to zero in on a few. B vitamins are important for many functions. They play a very central role in heart health, mental health, energy production, cell growth, blood sugar metabolism. So it's important to make sure we have adequate B vitamins on board. And I'm, again, not totally opposed to people taking a B complex, because people are so often low. What I like about a B complex is it gives you each of the B vitamins in low levels, so I don't have to worry about people overshooting. So let's focus on 3 important B vitamins: B6, B9, which is folate, and B12. And here are some food sources. And all of these B6, 9, and 12 do a lot of these functions that I've listed in the first bullet point. B6 is found in lots of animal products. So if you eat animal products, you're generally going to have adequate B6 levels. But there are a lot of plant sources as well. Here's an interesting one that most people don't think about: brewer's yeast. It is a strain of yeast, Saccharomyces cerevisiae, and it sort of has a cheesy flavor, so people will season food with it. Like you could put it on salads or popcorn or many different things. It's also a good source of protein, but it's a good source of B vitamins, actually. So especially for people who are plant-based, I highly recommend you look into this. Folate, really high in a lot of plant-based foods. Folate is the reason pregnant women take prenatal vitamins. We want to make sure there's enough folate to make sure that the neural tube, the spinal cord develops properly. So getting all of these different foods in will help make sure you have enough folate. And then B12 is pretty easy to get from animal products. So if you're a vegetarian or vegan, it's harder. And I always worry about people who don't eat a lot of animal products that their B12 level might be low. There are not a lot of plant sources of B12. Mushrooms, fermented foods, tempeh is fermented soy. So These are some sources, but generally, I do check vitamin B12 levels on patients, and I will supplement if they're lower than about 500 in blood when we check their levels. I like vitamin B12 levels between 500 to 1,000. So I'd rather you get it from food, but if you choose to take a B complex, that's generally pretty safe. Let's move on to vitamin D. This molecule is amazing. It's what we call a pleiotropic molecule, meaning it just does a lot of different things. It's much more than a vitamin. It can act as a hormone. It has antimicrobial activity. So it's just really important for anybody with inflammation or autoimmunity to have adequate vitamin D levels. And when it comes to mental health, it's important to recognize that there's vitamin D receptors in brain areas associated with mood. And so low mood has been associated with low vitamin D based on studies. And there was this Iranian study that showed when people supplemented with vitamin D3, they reported less severe depression. Okay. And there was a systematic review looking at many different studies, and this one was actually MS specific. And what they concluded was that there's a positive effect of vitamin D on symptoms of depression in MS patients. Okay, so I hope with anybody who's here with MS or other autoimmune diseases or inflammatory diseases, know your vitamin D level. It's as important as the medications you're taking to treat your autoimmune condition. So the recommendation generally is to get your total serum vitamin D level greater than 40. It's a rare person who can do this without supplementation. I hardly ever see anybody over 40. Most people are hanging out in the teens to the 20s to maybe the low 30s if they're not supplementing. And because many of you here have autoimmunity, I would actually like you to be an overachiever and get your vitamin D level even a little bit higher. So 50 to 60 nanograms per mil is a good total serum vitamin D level. So please check with your doctor to see what's optimal for you. But I like that range of 50 to 60 because it helps optimize the effects of vitamin D on your immune system without some of the problems that high levels of vitamin D can cause. So for example, people who have osteopenia, osteoporosis, probably should not aim for super high vitamin D levels, much above maybe 70 or 80, because it can impact phosphorus and calcium metabolism and lead to, calcium loss. But for most of you, a vitamin D level of 50 to 60 is a good target range. Food sources, that's why I've got this picture of shiitake mushrooms here. Not a lot of food sources for vitamin D, but tofu and salmon certainly help. Most of us just need to supplement. And insurance can be funny about paying for vitamin D checks. So if you don't know what your vitamin D level is and you haven't had one in the last 6 to 12 months, I would recommend just picking a dose of vitamin D, like 2,000 or 4,000 international units a day. Take that for 8 weeks and then go get tested. If you are not on supplementation, it's highly unlikely that you're in my target dose of 50 to 60. I like vitamin D3 with food because it gets better absorbed, especially if there's some fat in your food, because vitamin D is fat soluble. And if you had to choose between what form of vitamin D to take, I would take vitamin D3 over vitamin D2. Yeah, vitamin D2 is usually dosed once a week. Vitamin D3 is the animal form, has a longer half-life, and I generally find it does a better job of bringing up vitamin D levels. And you generally have to take it every day. Don't forget about the sun. Many of us go outside covered in clothes, hats, sunblock. So there's really no opportunity to get sun exposure. And if you think back to your ancestors, they weren't wearing clothes. We relied on our skin to help produce a lot of vitamin D for us. And if you think back to the last slide where I was talking about that Iranian study, how do Iranian women go out? They're covered head to toe. How can they get any sun? And so vitamin D levels plummet. We shouldn't be surprised at that. And then mood, gets wacky as a result. So I recommend getting outside and connecting with sunshine. Now, even if there's no sun out, getting natural light is still useful. You have light receptors built into your skin. 20 minutes, 3 times a week, between 11 and 3 are optimal. It's an optimal regimen for getting sun. If you have a personal or family history of skin cancer, I would talk to your doctor before doing this. But for everybody else, just going outside and feeling the sun on your skin is wonderful, and it'll have a good impact on your mood, and your immune system, and vitamin D, and your circadian rhythms, actually. All right, so another nutrient that's really important. Again, I worry about people that are vegetarians and vegans because oftentimes they can get anemic and have low iron stores. Iron plays an important role in mood because it works at the glutamine and NMDA receptors and GABA receptors. GABA plays an important role in anxiety, actually. So studies show that when you get somebody's iron levels up, their mood and their level of ability and cognition improves. So iron is really important beyond just mood and cognition. It's important for energy and many other things. So iron is not generally ordered as a regular lab, as a routine lab. So if you've ever had iron issues, maybe somebody checked iron studies on you, but I would look back and see if you've had a ferritin level. Ferritin is it's a reflection of your iron stores. And so hopefully that number is over 50. If it's not over 50, start by foods. I always like food first because our body has been designed to take in food and utilize the nutrients from it. And it's great to actually get your iron sources from both plants and animals because the iron in those two groups differ a little bit. So animal sources are listed here. Organ meats are actually really nutrient dense and high in iron. So once a week, if you want to do an organ meat like liver or heart, you can buy them organic, and it'll flood you with nutrients. It's just a very dense way of just getting a lot of nutrients in. It's very efficient. But if it's not something you want to do, that's okay. There's so many other foods you could try. There are lots of plant-based foods that also have this plant form of iron, from beans to seeds to green leafy vegetables and nuts. Okay. And then let's move on to omega-3. So there was a large study done looking at 26 different studies that were looking into the question of what is the impact of omega-3 fat on mental health. And they had over 2,000 participants. What they concluded was that the studies seemed to show that at about 1 gram a day of omega-3, with EPA making up at least half or 60% of the omega-3 content, can have some beneficial effects on depression. So, it wasn't looking like you needed to do high doses of omega-3 to get the benefit, but the EPA portion seems to be really important. And if you look at omega-3 supplements like fish oil, you will see the EPA and DHA listed on the back label, and you will see that the EPA is more prevalent than the DHA component. I will say that in clinical practice, oftentimes naturopathic doctors, integrative medicine, functional medicine doctors will use much larger than 1 gram a day because they just feel like you need bigger doses to get that effect on mood. But if you're just listening to this and you want to experiment, I wouldn't go above 1 gram a day. So somewhere between a combined dose of the EPA, DHA added together, adding up to 500 to 1,000 is probably a good place to start. Okay. Do that for 2 months and see how it goes. If you decide to increase your dose, please talk to your doctor. We want to make sure that you're being safe. There are a couple of issues with high omega-3 intake. So do also take it as food. Again, not a lot of food sources. So I would say seafood, and flax seeds, chia seeds, some of these foods are good sources, but it's generally not enough just to do foods to see that effect on mental health. So a trial of maybe 2 to 3 months of taking a combined EPA DHA dose of 500 to 1,000 milligrams is reasonable. Don't rely on what's on the front label of the omega-3 supplement, because it may include other omega-3s that don't really contribute to this mood effect. So you're only looking at EPA and DHA, you're adding them up, and you're aiming for the sum being somewhere between 500 to 1,000. Okay, so caution, blood thinner, slight blood thinner. And if you're on other blood thinners, I'd be very careful with omega-3. We generally don't like too many blood thinners on board in the same person, especially if they have different mechanisms, so you can kind of have a synergistic effect. This is especially problematic in our older patients where the brain volume has shrunk down and they fall and they can have a bleed in their head. So I always want everybody to be safe or on the side of caution. Go with low doses. If you decide to go higher doses, talk to your doctor to make sure it's safe. And then protein is actually really quite important for anxiety and depression. It's where the raw materials for our mood molecules or neurotransmitters come from. So studies show that about 1 to 1.5 grams of protein per kilogram of your body weight can help anxiety and depression, right? So if you are, let's say 50 kilograms, that would be 50 to 75 kilograms. It would be 50 to 75 grams of protein per day. I think we all tend to be protein obsessed, and people feel like they're never getting enough protein and they want to take protein shakes. If you eat animal products, it's not that hard to reach your daily protein goal. If you are vegan, vegetarian, I would do an analysis of your diet to see how much you're getting. And then if you can't add in food sources of protein that are plant-based, then I would go to a protein supplement. But generally, I don't think most people need to take a protein supplement. Now, I said 1 to 1.5 grams per kilogram of weight. I know some of you don't like the metric system, so I actually had to sit there and do math and figure out what this was in pounds. So you take your weight in pounds and multiply it by 0.45 and 0.65 to get your range. And I guess 0.5 is kind of right in between if you kind of just wanted the average. So be careful with overdoing protein. High protein levels suppress testosterone. This is important for men and women because testosterone is much more than a male hormone. Women have testosterone as well. Testosterone is actually a modulator of the immune system. And so if your immune system is not taking away as we would like, and you have an autoimmune or inflammatory condition, it's really important to make sure you have good, robust, normal testosterone levels. So don't overdo protein to drive down testosterone. Food sources. So I've given you a list of plant sources. People ask me this question all the time. How am I going to get enough protein if you were asking me to eat mostly plants? Well, here are the foods. Nuts and seeds are great. Beans and legumes are great. Soy, great source of protein. Nutritional yeast, also a great source of protein. A couple of tablespoons is, I don't know, maybe 8 grams of protein. And of course, animal products as well, if you choose to have them. So how do we get, rather than going through each nutrient and trying to address each separately, here's actually the approach I want you to take. We're going to go through a whole foods plant-based diet. We're going to eat food as it grows in nature, so it's unprocessed. We're going to eat mostly plants, at least 80%, and eat the rainbow every day. And this is going to flood you with vitamins and minerals and all the antioxidants and anti-inflammatory nutrients that you need. So now, this is something we work towards. It's not something that happens automatically, but I want you to start moving towards a plant-based diet. And by 80%, I mean, when you look at the surface area of your plate, at least 80% is covered by plants. Now, let's move on, and I'm going to go kind of fast here. Let's move on to sleep and mood. Sleep problems are really common in MS and in anxiety and depression because there's changes in circadian rhythms and hormones. You just can't get to sleep because your MS symptoms are hanging out or waking you up, or you're on a ton of medications and maybe they're keeping you up. A lot of people complain about not being able to sleep through the night. People who wake up early and can't get back to sleep, that might be a sign of depression. And people who wake up and just, toss and turn and wake up and can't fall back asleep multiple times throughout the night, they have a lot of ruminating thoughts, might be due to anxiety. And when we don't get sleep, we don't regulate our emotions, and that leads to mood issues. So, studies show that when we improve sleep, it improves mental health. That's pretty clearly outlined in the literature. And here's a large study that showed when we are more physically active, we're at a healthier weight, we remove caffeine, we can improve sleep. So how do you get good sleep? It takes intention and a plan. It doesn't just happen. And this is such a hard habit to start building because there's so many things that compete with our time. And we just generally take away time from sleep to do all the other things we want to do, like Netflix or Instagram or paying your bills at the end of the night or watching the news. So here are a couple of things to consider if you're not already doing them. Get early morning light because it helps reset your circadian rhythms. Your brain understands it's daytime. Daily movement and exercise. Exercise is the best regulator of nighttime sleep. There's no drug that can actually improve the quality of your sleep at night. Exercise is your most powerful tool to do that. No blue light for 2 hours before bed. If you must be on a screen, put something on your screen, like some of these filters you can download onto your screen to cut the blue light, or use night mode, or use amber glasses. And then find a bedtime routine. It's very hard for your brain to go from wakefulness into nighttime physiology, quickly. You got to cue the brain, turn the lights down, quiet the house. And if you're using substances that interfere with sleep, like caffeine, think about cutting that out for a couple of weeks and see how it goes. Sugar can do that. Medications, especially those that might be dosed at bedtime. Sometimes you'll do better if they're dosed in the morning. So go through your medication list. Ask your doctor, can any of these be interfering? And then it's perfectly fine to use some natural sleep aids until you start really getting into the rhythm of your nighttime routine and you see your sleep quality improve. I don't want people to take sleep aids forever, the natural ones, but I think they're reasonable to use. So let's talk about exercise, which I just said was the best tool to improve the quality of your nighttime sleep. Exercise is going to build up a healthier microbiome. It's going to regulate your circadian rhythms. It improves energy production. It releases the good mood molecules, and it boosts your self-confidence and your self-esteem. There's no drug for that either. So exercise is clearly linked to lowering stress and anxiety. Lots of studies actually show us this. And here's another meta-analysis showing that exercise reduced anxiety symptoms compared to controls. And it can actually be used in conjunction with people that have stress-related disorders, and it can be used as an adjunct to whatever you're already doing for anxiety and depression. It'll just help you more. And I suspect many of you are here, if you're already on medications, that they're not working as well as you hoped. So here are so many tools that you can add on to boost that antidepressant effect. So a third of patients actually don't respond well to SSRIs for depression. And CBT is cognitive behavioral therapy. It's just not enough. And we know exercise is very impactful for mild to low depression, and it can actually rival the effect of SSRI medications. That's how powerful it is. This can be both aerobic and non-aerobic exercise. So you pick what works for you. In fact, I think it's great if you can get into aerobic activity to do a combination of both. And for some of us, maybe who have weakness in our legs, but still have good use of our arms, we can use resistance bands. We can really get into aerobic levels of exercise, just being creative and working with our physical therapist to figure out what's possible. And another study just showed a longer study looking at exercise 3 times a week for 9 weeks was really effective for depression. So I think the way exercise works for depression is when you exercise today, it does help you immediately. I've never had people exercise and they tell me it made their depression worse or it made their anxiety worse. Never, not one time. But it can actually, if you actually get into a routine of it, it actually is that antidepressant effect is further boosted. You'll get more out of exercise if you do it long term. And by long term here, it's 9 weeks. So think about where you could be in 9 weeks. And I think that it's important to find exercise that fits and is something that we're willing to do. So exercise is an important addition to whatever you're already doing to treat anxiety and depression. And exercise can actually have a preventive effect for anxiety and depression. So maybe you're here because you just want to know how to avoid mood issues. Exercise is your tool. And I really like weight training. I mean, it has so many benefits, especially as we get older. But when we do weight training, it actually mimics the symptoms of anxiety. Heart rate and blood pressure go up. And then when we rest in between sets, our body actually learns how to adapt to those symptoms. Isn't that interesting? So weight training can actually be really helpful for anxiety and depression. So however you choose to do that, whether it's free weights or resistance bands, it's all great. So think about incorporating more weight training into your routine. And as I said, find something you enjoy and then answer these questions like, are you a person that needs to exercise with others or by yourself? In the morning or in the afternoon? Do you need to be at the gym or at home or in a class? And what exercise are you going to do? I hope that you mix and match a couple of different exercises because it's good to challenge your body in different ways. And I'm going to go through here the 5th lifestyle habit, toxins and mood. Lots of data that shows correlations between BPA found in plastics, heavy metals, pesticides, and anxiety and depression. Okay, so while we can't easily make causative associations, we know there are a lot of correlations. So what do we do about that? Minimize your exposures. Here are 3 high-yielding things you can do. Use non-toxic products, including personal care products, cleaning products, furniture that you bring into your home. Buy things that aren't bringing more toxins into your home because these things don't stay put. We actually breathe them in. When we touch them, they get in through the skin. When you buy conventional raised food with pesticides and herbicides, you ingest them through the GI tract. There's a great website called the Environmental Working Group. It's the ewg.org. And that's a great resource for starting to find non-toxic personal care products and cleaning products. Eat organic as much as possible. And I highly recommend getting a HEPA air filter and a water filter. Ideally, if you can get a reverse osmosis filter, that's going to be the best. It's going to remove the most contaminants. Okay, let's talk about herbs and supplements here. So lavender is wonderful. It's very calming, and there is actually some science behind this. There was a study, small study, looking at 9 healthy adults. They didn't have sleep problems, but once they fell asleep, they diffused lavender in the room, and when they woke up, the people who got lavender actually said that their sleep quality was better and they had more daytime vigor. I think we all need more daytime vigor. So, this is an oil that can be extracted when you get it as an essential oil form. It's been known to shift brain waves to delta waves, which correlate with better sleep. How do you, and it also does bind receptors. So it does have a biological effect on the brain. You can get the essential oil and put it topically on your lip, so you can breathe it as you're sleeping. You could put it on your pillow. You could diffuse it. Try it and see if it works. It's a low risk tool that I think a lot of people will really enjoy. Ashwagandha is another one of my favorites. This can also be called Indian ginseng. It's an adaptogenic herb that supports our adrenal glands. Adrenal glands are involved in helping us cope with day-to-day stresses, whether it's physical stress or emotional stress. And so ashwagandha can help people who are anxious and stressed and can't sleep. There was another meta-analysis of 12 different studies that showed using ashwagandha led to less anxiety and less stress. And this is one supplement that can help you sleep through the night. So if that's the problem you're having, you fall asleep fine at the beginning of the night, but you can't stay asleep, ashwagandha can be helpful. I take it for at least 4 to 8 weeks before deciding if it's going to work for you or not. Lots of other supplements out there for anxiety and depression. There's not a lot of data. Some of them can be harmful. I don't really like St. John's wort, can affect the liver. Some of these here, 5-HTP, SAMe, increase serotonin levels. So if you're on other antidepressants, you can have too much serotonin, and that could be dangerous. CBD, THC, derived from the hemp plant, can unmask some psychiatric symptoms that we'd rather not doing. So be cautious, be careful. Don't just go out and buy everything and try it. Work with a provider who can guide you. I really like saffron. It's you can actually, I co-facilitate a mental health group over at Stanford, and one of the things that I've learned from my colleague is that you take saffron threads, maybe about 5 or 6 of them, and put them into like milk or a plant-based milk at night, and you drink it, and that has an antidepressant effect. It's also helpful for sleep. So that's kind of a fun one. Let's talk about acupuncture and Chinese medicine. I think this is an underutilized tool for mental health. I do practice Chinese medicine and acupuncture mainly. I find it to be really helpful in reaching symptoms that Western medicine can't. So if your mood is not being adequately treated with your medications, keep taking your medications and then add on some of these things we're talking about here. So, and acupuncture is a form of energy medicine. It's about balancing the qi in your body. And in this picture, you can see these lines, and each line is a meridian or a highway where energy flows. And by putting in a needle, you're basically bringing attention to this meridian where energy is flowing, and then your body does that fine tuning of the energy. So Chinese medicine isn't just acupuncture. It's also herbs, cupping, moxibustion, lots of different techniques. And there are studies that show that acupuncture actually can help change cortisol levels. It can change the tone of your autonomic nervous system. So it can actually change heart rate variability. It can take you from being kind of in fight and flight to being in the relaxation response. So acupuncture is really powerful, and many insurance plans now cover it. And so I would highly recommend you looking into whether or not this is an option for you. So many studies backing up the effects of acupuncture. However, I will say the data is not as strong as we would like it to be. It's really hard to do acupuncture research because it's hard to have controls. They try with using sham acupuncture needles or putting the acupuncture needles outside of the acupuncture point. You're still having an effect by those attempts to create a control group. So, so there's a huge meta-analysis here of 32 studies that showed positive results for anxiety. And I can tell you, oftentimes I'd have a patient who would come in so amped up, so anxious, where I couldn't even have a conversation with them. And they didn't even come in for acupuncture. They were in just for like a follow-up visit with me. And I would put one needle at an acupuncture point at the top of the head. And within a minute, they would calm down, right? So that's much more than a placebo effect. At least 70% of people actually respond to acupuncture. So it's a wonderful tool. Other studies have shown that acupuncture is really effective for lowering the severity of depression compared to controls. The quality of the evidence in this study was low. And here's another two Chinese studies that showed acupuncture along with moxibustion, which is an herb called mugwort that's added onto acupuncture, was actually effective for depression, and the benefits persisted far beyond the acupuncture treatments, even at 3 months. Okay, so a couple of other things I want to add on. Light therapy is actually underutilized. There are these light devices that you can get. So why does this matter? We actually think about this. Think about how you go through a day. When the light goes down, what do you do at home? You turn on your home lighting, right? So now you're getting exposed to light when your brain really just wants to be in darkness because it wants to turn on that nighttime physiology, but it can't because you have lights on, you're looking at a screen. That's another source of light. We also have sunshine deficiency. We're not going out and getting sun on our faces and on our skin. So we have to start thinking about how to have a better relationship with light. These light boxes or light devices can help SAD, which is seasonal affective disorder. This is the time of the year when people start really feeling the low mood come up as our days get shorter and shorter. And for people whose circadian rhythms are off, these light devices can be really helpful. So you want to basically get light early in the day. And this study showed an hour of light a day early in the day actually improved depression scores. So here's what you're aiming for. You want to get a device that shoots out 10,000 lux, and you want to hang out in front of it for about 30 minutes in the morning. Okay. You can be sitting there, having breakfast or doing something else, but you need to let that light come in through your eyeballs. And there's another kind of light therapy, right? Just going outside. Sunshine works too. Go outside, get natural light on you, whether it's sunlight, whether it's an overcast day, it all still works. Aim for at least 30 minutes before 10 a.m. This recommendation of 10 a.m. is not scientific. I've made it up. I think it's a good guideline because it gets us out early enough. You're welcome to do much more than 30 minutes. So if you have work meetings, could you take them from outdoors? You don't have to be under the sun. You could be in the shade, but you still have natural light bouncing around you. This helps with resetting your circadian rhythms. It helps with getting better sleep at night. All right, that was a lot. I don't want you to do all of it, but I want you to do 2 or 3 things that we talked about. It's always great to have a little notebook where you can start writing things down, taking notes about what you're doing for your health. And if you keep showing up and learning with us, you'll go far. Think about where you could be in 6 months to a year if you continue showing up and doing the things we talk about. It makes a difference. I've never seen somebody engage with the things I've talked about and do worse. Never, not one time. And all of these things are going to help you do better with your MS medications. They're going to help you do better with your anxiety and depression medications. Hopefully you'll experience less side effects and you'll just have more joy and get through your day better quality of life. I think that's, at the end of the day, that's what it's all about. Like, are we able to participate in our life in a way that we want to show up for ourselves? Next month's webinar is on brain health. I'm going to work really hard to keep it to 5 tips, but we'll keep it to 5 major tips, and we'll talk about how you can incorporate them. But brain health starts now. People start worrying about brain health when their memory starts to go. It's too late by then. The time is now. So I want to talk to you about that next month, December 6th. Maybe by tomorrow, we'll have it available to be registered for on our website. And thank you for being here. Self-care is MS care. This is not selfish to spend an hour to learn. It's not selfish to go to bed early or to stick to your exercise regimen or your stress management regimen. It's all important and it all matters. And I hope that you have family that supports you and hopefully does this with you. So thank you for being here.